Welcome back to Fox 51 today. Trinity Mother Frances' Flight for Life services, so very important, saving East Texans' lives all the time. Here to tell us more, though, they've made some big expansions.
They have, yeah.
Is Will Nouse. Good morning, Will.
Morning, Rachel. How are you guys doing today?
Good.
Doing great. You know, this is some very good news for Trinity Mother Frances. You said you've been expanding these services. Can you tell us about that?
Well, as of yesterday, we opened a new base for our Flight for Life program at the East Texas Regional Airport in Longview. We worked with Good Shepherd and the folks at Champion EMS to expand Flight for Life services by adding a new helicopter, an EC-145, which is an instrument-rated helicopter, air transport service, basically an ambulance that flies.
Wow.
Based in Longview, that'll give us a much quicker and better access to Harrison and Gregg County specifically, but it expands access everywhere from southern Oklahoma down to northern Houston, the eastern side of Waco, over to western Louisiana and south Arkansas. So it's almost 100,000 square miles of coverage by those 3 helicopters.
So I guess if someone is picked up, then they go to, how does that work? Which hospital do they go to? How does that work?
Well, as most ambulance services go, it's the patient's choice where they go. If you are picked up by an ambulance, in third-party ambulance, I should say, in most cases, you choose where you want to go. However, in the case of a trauma, terrible accident, things like that, no one gets flown over. You fly to the safest, best, closest place. So whatever's going to give you the best chance for survival or best care in the quickest amount of time to help save your life. Those minutes right after an accident are very, very important. Medical officials call those the golden hour, which is the time immediately after. That's when the most harm or help can be done.
Now, how far out do your Flight for Life services do they reach? How far do you go?
Well, it's about 100,000 square miles. We have 3 different bases, one in Winsboro, one in Palestine, and one in now Longview at the East Texas Regional Airport. So they go, depending on where they are at a certain time, they go to wherever is quick, or whichever helicopter is closest goes to the accident, so to speak, as quickly as possible. So, but it's about 100,000 square miles over this entire portion of Texas. It's a pretty expansive area.
I would say so.
So with this system now, it's been in play. I guess, how long has Mother Frances had that? It's a good while now, right?
Yes, the very first Flight for Life system started in 1985, and then began to expand services over the time period, adding different helicopters, expanding the coverage area, et cetera. And this new helicopter is the EC-145 is our newest. It's an instrument-rated helicopter, which means I'm not a pilot, but essentially what it means is it has instrument-rated capabilities and it can take off, fly in weather that is not ideal. So a pilot might not be able to see well enough to fly properly, but the instruments can handle it for him. So it makes it a lot safer if there's an accident in bad weather, or which you know that happens quite a bit, auto accidents, or if the weather doesn't permit the best flying conditions, the helicopter and the airport working together can still operate. Oh,
that's great. You know, now you've got the Longview helicopter. Do you know if Trinity Mother Frances has any plans to possibly get a new location anytime after this?
Well, this is a very large step for us and for Champion and Good Shepherd. But at the moment, you know, down the road, who's to say? I mean, the goal is to expand access to as many patients in East Texas as possible. That's kind of a buzzword in healthcare right now. So, and at any time, because what you really want to do is get the best services to the most people as quickly as possible. That's the goal all the time. So down the road, I'm certain that there will be an expansion of services or new equipment or whatever is best for the patient to service them and their needs in a short amount of time. That's the objects we'll pursue.
Well, that is some great news to hear. Thank you so much for stopping by this morning, Will.
Thanks.
Absolutely.
All right, well, coming up next.